Recent research is revealing the true nature of obesity, shedding light on one of today's most common questions. Why can't I keep the weight off? The traditional view that obesity simply results from a failure to maintain a healthy lifestyle overlooks how the body regulates energy. Recent studies show that weight regulation is a complex process governed by hormonal and neuronal signals between the brain and a system of organs and tissues. New research also reveals that as body fat levels increase, the body adapts and sets this elevated weight as a set point or a new normal. Since this new fat level is recognized as ideal, the body will attempt to maintain it. With this elevated set point, the body defensively responds to even modest diet restrictions by increasing hunger and cravings, decreasing satiety, and slowing metabolism, all to prevent starvation. As part of a basic biologic instinct, well preserved throughout human evolution, even an obese body is programmed to protect fat levels. Because this weight-regulating mechanism does not recognize obesity and subsequently does not allow the return to a healthy weight, obesity presents in patients as a chronic disease. Similar to other metabolic functions, such as blood glucose, LDL cholesterol, and blood pressure, body fat set points are affected by genetic predisposition, environmental exposure, and developmental history. Though all of these factors contribute, the recent epidemic rise of obesity can be primarily attributed to the modern environment. Negative changes include alterations in the chemical and nutrient content of our food, a lack of exercise, high levels of stress, inadequate and disrupted sleep, and the widespread use of weight gain-promoting medications. The result is that many individuals have become obese and, despite efforts to lose weight, remain so or even gain weight due to the compounding effects of metabolic dysfunction. For effective weight loss, calorie intake must decrease and calorie output must increase. However, the obese body treats a calorie reduction as a starvation threat and defends by conserving energy and restoring energy-rich fat. Throughout most of human history, calories were scarce and hard to get, so we have numerous natural defenses against starvation. We have no defenses against overeating because we never needed them. A landmark study of over 4,000 patients found that on average, fighting obesity with diet and exercise alone only achieved a 20-year sustained loss of 4 pounds. The New England Journal of Medicine reported that though dieters may initially lose weight, their bodies then encourage fat regain by triggering a cascade of changes in hormonal and neuronal signaling, which did not return to pre-diet levels even 12 months later. This unrelenting self-preservation mechanism may explain why most weight loss attempts fail in both the short and long term. Successful weight loss is important because obesity has been linked to increased risk for diabetes, an ever-increasing public health threat, as well as cardiovascular disease, the world's leading cause of death. Other diseases related to metabolic dysfunction have also been linked to obesity. The key to reducing these health risks and successfully treating obesity long-term appears to be treatments that change the physiological body fat set point. For many patients, this requires therapies that can deliver long-term weight loss of more than 10%. New research indicates that bariatric surgery, increasingly referred to as metabolic surgery, has lowered set points and had profound metabolic impacts beyond that of weight loss. The surgery changes hormonal and neuronal signals, decreasing appetite, increasing satiety and metabolism, and encouraging healthier food preferences. Positive weight-independent changes, such as glucose homeostasis, lipid biology, and more, have also been observed. The New England Journal of Medicine reported that more than 3 times as many diabetics achieved glycemic control of 6% or less through bariatric surgery versus those who only underwent intensive medical therapy. This new data on the complexity of weight regulation, the concept of set points, and weight loss study results has shown that diet and exercise may not be enough to achieve the most advantageous long-term benefits for obese patients. In contrast, metabolic and bariatric surgery patients experience on average over 45% excess weight loss and lower body fat set points. This allows them to successfully keep the weight off, reducing their risks for a host of obesity-related diseases and improving the quality of their lives.